Bismillahirrahmanirrahim. Assalamu alaikum. Welcome to my microbiology class. We will talk about different clinical cases in microbiology and we'll although study the basics but we'll do it from a clinical perspective. I am Dr. Yahya Noori, your teacher for this course. As our main textbook, we'll follow the review of medical microbiology and immunology by Warren Levinson and we'll follow its 11th edition. Once upon a time, a very long time ago, I was standing at a shop which was a superstore having a section for pharmacy as well. So the person who was dealing with medicines was probably not a trained pharmacist. So a guy came to him and asked for some sort of medication because he was having a diarrhea due to taking antibiotics. Those antibiotics were also probably self-prescribed. So the shopkeeper gave him flagyl. Now you would understand why it is important to know that you should be aware of the causes of diarrhea. There are different causes of diarrhea which could be infectious or they could be non-infectious. If we talk about any symptom, the symptom could either be because of an infectious agent or a non-infectious agent. So today we are going to talk only about the infectious agents, and these infectious agents can cause different symptoms. What are these infectious agents? So after once we've done with the slides, you would be able to list the cause which are infectious and they cause different symptoms in a person. Secondly, you should be able to explain the value of using the correct treatment modality for infectious diseases. Organisms that cause infections are mostly microscopic, but they can be seen with the help of naked eye. There are five major groups of organisms which can cause human infections. You probably would now have heard about the details related to COVID-19. So COVID-19 was actually a virus. There are a number of viruses which cause common infections. For example, influenza virus, which is very common when there is winter season. The other type of infectious agents are bacteria. Bacteria are prokaryotic organisms and they can cause several diseases. You might have heard of bacterial pneumonia. Pneumonia can be because of a virus or a fungus, but bacteria are more common in causing pneumonia. There are other infections as well. Some of them are really severe, for example, plague, and then others which are relatively mild. So you might have heard about malaria. So malaria is a disease which is caused by protozoans, Plasmodium. Then come fungi. Fungi are also specific organisms which are eukaryotic. Protozoans are also eukaryotic, and these can cause different infections as well. They can mostly cause infections on the skin, or sometimes you get fungal systemic infections, fungal pneumonias, and other infections in the body. So the last type of microorganisms that cause infections are the worms. The worms can cause infection in the intestine, they can cause infections in the different body systems, and the infections may range from mild to severe and life threatening. Some of the worms can even cause blindness. So these are the different five classes of microorganisms which cause disease. You should be able to appreciate that all these five different type of organisms have different systems which work in their body, and therefore the type of drug which you are supposed to choose to treat them is always going to be different. So a drug which is active for bacteria is not going to work on the viruses. It is not going to work for the fungi, and the drug which is given for protozoans may have implications for your own body because your body is also eukaryotic. So you should keep these clinical correlates in mind. So I'll leave a quiz link in the description, and where you can go to the Google quiz and take a quiz. And if you put your email there, you will probably get the answers to that quiz as well. So that's going to be a little revision exercise. Thank you very much. I'll see you again. Assalamu alaikum. Oh, and the last thing, if you want to give any suggestions, you want to ask any questions, you can email me on y.noori@dohs.edu.pk, and you can follow me on these social media accounts. Thank you. Assalamu alaikum again.